Good evening. I'm Kelly Gear-Ripken, National Chair of A Women's Journey. On behalf of Johns Hopkins Medicine's A Women's Journey, thank you for joining us this evening for our monthly webcast series, Health Conversations That Matter. A Women's Journey strives to improve your well-being through health education. The impact of hearing loss is broad and can be profound. They include a loss of the ability to communicate with others. It can delay language development in children as well. These can lead to social isolation, loneliness, and frustration, particularly among older people with hearing loss. Tonight, we are delighted to be joined by otologist Dr. Carrie Nieman, who is an associate professor in the Division of Otology, Neurotology, and Skull-Based Surgery in the Johns Hopkins Department of Otolaryngology, Head and Neck Surgery. Her clinical practice is dedicated to the medical and surgical management of hearing loss. She is core faculty in the Johns Hopkins Cochlear Center for Hearing and Public Health, where she focuses on affordable and accessible hearing care for older adults and is a frequent consultant with the World Health Organization. So please use the Q&A on your screen to pose your questions to Dr. Nieman, who will respond during the last 20 minutes of tonight's conversation. Our webcast will conclude at 8 p.m. this evening. I want to take this opportunity to acknowledge and thank Johns Hopkins University's program, Hopkins at Home, for their production assistance. And you can visit their website for additional lectures and courses throughout the year. And now I'm pleased to welcome Dr. Carrie Nieman.
Thank you, Kelly, for that warm welcome. I'm really excited to be here today to share some thoughts about age-related hearing loss, and we'll explore it from a couple different angles. So thank you for joining us today.
Thank you.
So just to put it out there, I will be talking about some work that is funded by the National Institutes of Health, and I do serve as a nonprofit board member for a couple of different organizations. A little bit about myself before we get started. I attended Northwestern as an undergraduate and stayed in the Chicagoland area and attended the University of Illinois, Chicago to do my medical degree as well as a master's in public health, and then came to Hopkins to do residency in otolaryngology-head neck surgery, and then spent a little bit of time doing some advanced training, a little bit of a fellowship in Switzerland, and then started on faculty, so stayed on faculty here at Johns Hopkins, and has been a wonderful experience and happy to continue to be part of this institution. So one of the things that we'll spend a little bit time on, as I am a clinician, I'm an ear surgeon at Hopkins, but I also spend a lot of time kind of thinking about things from a public health perspective when it comes to age-related hearing loss. And so I'm joined in that work with a number of colleagues. We're based out of the Bloomberg School of Public Health within Hopkins at the Cochlear Center for Hearing and Public Health. And we have an extraordinary team there. The director of the center is Dr. Frank Lin, who is an otologist like myself at Hopkins. We have epidemiologists, health service researchers, audiologists, a really outstanding team that all comes together to think about age-related hearing loss from a public health perspective, which is something we haven't always done when we think about hearing loss, particularly among older adults. So when I say public health versus medicine, I think it's important that we think through what that means and that there's a little bit of tension between those two kind of perspectives. So when I talk about public health, I'm talking about things really from a big picture population perspective, right? We'll only always have a certain amount of resources to be able to provide care and as high a quality care to as many people. And so we balance a number of different competing priorities when we're thinking about kind of that public health or population level. Versus when I have my kind of physician hat on in terms of medicine, we're really talking about individuals, right? We're talking about providing that best, highest quality care to the person in front of me when I'm seeing somebody for a clinic visit. And so we'll talk about public health versus medicine in terms of how we think about age-related hearing loss. First, we'll spend a little bit of time talking about age-related hearing loss from a public health perspective, and then we'll talk a little bit more from a medical perspective. What are some things that you can think about as a patient who may have hearing loss or for a loved one of yours who may have hearing loss? So we'll start with the basics. What is hearing loss? And again, this is really basic. So there's really two parts to hearing, and it's a process of encoding and decoding. So we have sound waves that enter our ear. And what they need to do is to get to the cochlea, the inner ear. The cochlea encodes that, the inner ear, and sends that signal on to the brain. The brain then needs to decode that. And so if that message is clear, sound waves come in, your ear understands it, sends the message on clearly to the brain. Brain then processes and says, yep, I know what I heard. But that process can change with hearing loss. And there's a number of different things that can affect hearing. So we talk oftentimes when we're thinking about genetics, definitely an area that is growing within kind of hearing loss and our understanding of it. Certainly noise exposure, we know, is a big contributor to hearing loss, especially over a lifetime. But then by far and away, aging is the biggest risk factor when it comes to changes in our hearing. And we don't really be able to differentiate kind of these different causes of hearing loss, but generally aging is really the biggest one that we think about. And so when we have aging and some of these different processes that are affecting the inner ear or the cochlea, it can affect this process of encoding and decoding. So we have sound waves that are entering the ear, that coming to the ear, that inner ear, the cochlea, trying to process this. But because of changes that have happened in the inner ear, is no longer able to kind of encode that message to that same kind of integrity that it used to be able to. And so that it ends up sending kind of a garbled signal onto the brain, where the brain then has to kind of process this garbled signal. And we don't always understand what people are saying. So a lot of times hearing loss can be challenging to kind of pick up, right? Especially as we get older, it's gradual. It's something we're not always aware of. And so a lot of times, even when we're talking about a mild to moderate degree of hearing loss, we're talking about things like, I can hear you, but I can't always understand you. Or I can feel like you're mumbling, that it's not always, you as a person who has hearing loss, but it's everybody else that's mumbling. And those are some of the ways we first start to become aware of our hearing loss or hearing changes. And some of the hardest environments to listen in, right, are when we have a lot of background noise, restaurants, big social gatherings, family gatherings, things like that, where there's a lot of things going on. That is a place where if we start to have a little bit of issue, that can be a sign where you have some mild hearing loss that's starting. So it's a little bit in terms of the basics of hearing loss. Something that has really changed over the past decade or so is, why does hearing loss matter as we age? We used to not always think that it matters that much, but that has very much shifted in the past decade or so. So it matters, one, because it is really common. If we look at everybody in the United States, and we look at everybody who's 70 years or older, 2/3 have a clinically significant hearing loss. And if we look at everybody in the United States, 80 years or older, over 80% have a clinically significant hearing loss. And most of that hearing loss is in the mild to moderate range. And most of that is what we would label as age-related hearing loss. So what has changed is that those numbers have not changed. They've only continued to grow as our population ages. But what has changed is how we think about it, right? We can no longer think about aging in terms of hearing loss as just this benign part of the aging process. Age-related hearing loss has been independently associated with negative outcomes in almost every aspect of aging. So age-related hearing loss has been associated with things like accelerated cognitive decline. It's been associated with things like dementia, with falls, depression, social isolation, loneliness, and increased hospitalization in terms of risk, and increased spending in terms of healthcare spending. So really think about almost any area in terms of aging, and age-related hearing loss has been independently associated with negative outcomes in those areas. So this is a figure, I know it's small, that comes from a really important report that came out first in 2017 and was updated in 2020. And so some of you may have heard of in the popular media and otherwise, the association between hearing loss and memory issues. And so the Lancet, which is a well-respected journal and medical institution, comes together and brings kind of experts from different areas together. And they, for the first time, got together and looked at dementia in terms of they wanted to look over the life course. What are all the potential risk factors for dementia from birth, early life, midlife to late life? And in 2017, because of a lot of work that has been done here at Hopkins by our team in terms of looking at the associations between hearing loss and all of these potential negative outcomes, we had enough data for the first time for hearing loss to actually be considered a risk factor when they looked at all of these potential risk factors over the life course. And what they found is that hearing loss was the largest potentially modifiable risk factor for dementia. And the reason that we can kind of put that label on it is because of how common hearing loss is and how kind of significant that degree of association between hearing loss and memory changes has been. So what we found in the literature is that even a mild amount of hearing loss is associated with a 2 times increased risk of dementia. A moderate degree of hearing loss is associated with a 3 times increased risk of dementia, and a severe hearing loss is associated with a 5 times increased risk of dementia. And so those are not kind of individual level numbers. I'm talking about at a population level. So we can't necessarily say, I have mild hearing loss. Does that mean I have a 2 times increased risk? We can't use it to that level degree. These are numbers that we kind of see at a population level. So it begs then the question of, if we do something about hearing loss, can we slow or change the trajectory in terms of memory changes? So when public health terminology, is hearing care a form of primary prevention? If we address hearing loss, can we slow dementia? So there's a lot of ways that we have thought about how hearing loss can be associated with memory changes. One can be that you've got this garbled signal that the brain is trying to process and it takes resources away from other things that it needs to be doing in terms of cognitive load. Are there structural functional changes that are happening in the brain because of hearing loss that are then having downstream effects to changes in cognition? We also know, independent of all of this, that social isolation alone is a risk factor in and of itself for cognitive changes and memory changes. So is that the mechanism by which hearing loss is connected with memory changes? Or is it some kind of other kind of process outside of this? We don't really know the answers to this, but these are some of the ways we think that they may be connected. And so can we enter here and address hearing loss and see changes downstream in some of these different areas? So that brings us to an exciting trial that I want to share a little bit more about. So this is the ACHIEVE trial. This is the Aging and Cognitive Health Evaluation in Elders randomized trial. And you can see the trial started back in 2017. It's led in part by my colleague, Dr. Franklin, who I mentioned earlier, and a number of my teammates and colleagues. And so they really wanted to put forth and answer the question of whether, if we give randomly people who have hearing loss, half, who don't have any memory changes, kind of a hearing care intervention, and the other half who have hearing loss but no memory changes, and we see how they do in terms of, can we see if hearing aids slow cognitive decline? And so this took place from 2017 to 2022 or so, and they recruited around 1,000 participants from 4 sites around the country. You can see they were around 70 to 84 years of age. They had hearing loss, but were not using hearing aids, and they all had normal cognition. And so there was 2 groups that made up these 1,000 individuals. One group was actually part of a study that's been ongoing for 30 years and have been followed, that it was originally about heart health. And those individuals have been followed for 30 years in this study called the ERIC study. And then there was a whole group of individuals who had just recruited, kind of new for this study. And so these were the 1,000 individuals. And as I said, randomly, half of them got hearing aids and were followed, and the other half met with people in terms of learning about successful aging, but they did not get hearing aids. And so those individuals were then followed for 3 years. And we wanted to see, did we see changes in cognition? And so these results were just published this summer in the Lancet. And so they looked at 2 groups. I know this is a really busy slide. I tried to put in orange here the big box. So those 2 groups, those 1,000 individuals, they looked at everybody, and they didn't see a change in cognition over 3 years in terms of the hearing aids didn't seem to have a big effect when we looked at everybody. But when we looked at the group of individuals, those individuals who had been followed for 30 years, those individuals were older, and they had a couple of other risk factors for cognitive changes. But at the start of the study, didn't have any cognitive changes that we would consider concerning. And those individuals over the 3 years, the ones that used hearing aids, actually had a reduction or a slowdown in their changes in cognition. And so their cognitive changes slowed by 48% over 3 years' time, compared to those individuals who had hearing loss but did not receive hearing aids kind of in that group. So what that means in terms of the big takeaway is that for individuals who are at risk for changes in memory and cognition over time, that by addressing hearing loss, it seems for those individuals that we can slow changes in memory by addressing hearing loss. This is a really exciting and important advance in our field in terms of how we think about and why hearing loss may matter. So how do we manage age-related hearing loss? For many of you, it comes down, and there's kind of two main parts. Sensory management, which means how can we make sure we're getting as clear a signal as possible to the inner ear, to the brain, and then kind of the counseling part, which we call oral rehabilitation, basically how to live well with hearing loss. And so there's two main things, hearing aids and cochlear implants. Hearing aids are the thing that we use for the vast majority of people. This is what we use for individuals with mild to moderate degrees of hearing loss. And for the individuals who have more severe hearing loss and who are no longer benefiting from hearing aids, which are a small portion of the overall population, we then think about things like cochlear implants. So what do we know about hearing care, not just hearing loss, but hearing care among older adults? We know that hearing loss rate is really common, but very few people actually use hearing aids. We know there's a lot of reasons why that may be the case. If we look at everybody in the United States who have hearing loss, only around 15 to 20% of older adults with hearing loss actually use hearing aids. But we know right now that hearing loss seems to matter as we get older. And so what I would argue, we now need to be thinking about hearing care as an essential part, an essential tool for aging well. So we really need to be thinking about all those things that we do for healthy living. Taking care and addressing our hearing needs to be right alongside all of those things. And we need to be thinking about how do we make sure everybody has access to the care they need. So just as we see kind of throughout healthcare in the United States and elsewhere, we see differences by things like race and ethnicity, where if we look at individuals who have age-related hearing loss, we see that around 20% of white older adults use hearing aids, but only around 10% of African American or Mexican American older adults use hearing aids, and that comes from nationally representative data. When we look at other data in terms of not necessarily nationally representative, we see some of those same differences by race and ethnicity. And we also see differences by things like socioeconomic position, things like lower education, there's lower rates of hearing aid use, or things like total assets or in terms of kind of measures of income or socioeconomic position. So we see some of the disparities that we see, unfortunately, throughout healthcare, we see within hearing care as well. So if we're thinking about hearing care as this important thing, and we know that not everybody gets hearing care, again, for a lot of different reasons, what can we do to try to expand access to hearing care, particularly if we're looking at it from this big picture population perspective? And so there's been a lot of work in this area in the past number of years now. So back in 2015, the President's Council of Advisors on Science and Technology, PCAS, they went through and said, well, what are things that are really important if we're going to move the needle of more affordable hearing care to get it out there? And their number one recommendation was we need to think about offering over-the-counter hearing aids to decrease the cost of hearing aids. That then was followed by the National Academies of Medicine, which is a US kind of base group that puts together a lot of different kind of national recommendations. And there was a year-long study on thinking about hearing care. How do we make it more accessible and more affordable? And that year-long study came out with a number of different recommendations, one of which was, yes, we need to move forward with over-the-counter hearing aids. And then many of them were there, but another one to highlight is that we need to think about more models of hearing care, that it's not just about seeing an audiologist or seeing an otologist or an ENT, but that we need to think about what are other ways that people can actually access hearing care if we're going to serve all of those older adults who have hearing loss. And so from there, in August 2017, right, that's like record time, 1 year later, there was national, federal, bipartisan legislation that was put forward to move forward with over-the-counter hearing aids. That's huge. And that's Dr. Franklin, like my colleague that I mentioned, testifying in front of Congress in support of over-the-counter hearing aids. Our team has been behind this, kind of pushing it forward as much as possible, and really an exciting advance in this field. So that was August 2017. but those regulations didn't trickle through and actually come into practice until more recently. And the goal, kind of again, from like a theoretical big picture perspective, the goal of over-the-counter hearing aids is how can we drive down cost of over-the-counter hearing aids, just period? How can we try to improve quality as much as possible? How can we make devices as responsive to user needs as possible? And can this open more doors to new models of care that is not always dependent on seeing an audiologist or seeing an ENT? And so this marriage between over-the-counter devices and then thinking about other models of care is a lot of the work that I do on the research side of things. And so specifically thinking about community delivered hearing care. So outside of the clinic, what can we do? And when I talk about community delivered hearing care, what I'm talking about is a lot of different settings. That's not just a clinic. And how can we partner as ENTs and audiologists with different types of individuals who may have a little less training, but can do a really good job of fitting and getting people started with hearing aids. And that really relies on kind of new and different mobile technologies. So our work in that space is what's called Baltimore Hears, or the Hears program. And that program is designed to try to, how can we remove as many barriers as possible and have an over-the-counter device be fit by somebody like a community health worker, or for us, an older adult peer mentor, and get somebody up and running with a device without ever having to see an ENT or an audiologist like myself, in terms of trying to get things out into practice as quickly as possible. In the Hears program, it's structured in that it's 2 hours. Somebody will meet, the community health worker will meet with an older adult with hearing loss. They'll go through the basics of age-related hearing loss. They'll go through a step-by-step fitting and orientation to an over-the-counter device. And then it'll be coupled with some things about how to live well with hearing loss in those kind of structured 2 hours. As an example of kind of how we talk about hearing loss in the study in terms of the program. And then this is an example of kind of the step-by-step fitting and orientation to some of the devices that we use. And so here are a couple of our older adult peer mentors in action. So they are the ones who are out in the community settings. We work primarily in affordable housing throughout the Baltimore area, as well as senior centers throughout the Baltimore area. And so an individual with hearing loss would meet with one of our older adult peer mentors and get up and running with an over-the-counter device. And so here are a number of our older adult peer mentors. And so the results of that trial, does it work in terms of does and can a community health worker fit somebody with an over-the-counter device, and do they benefit? That was the question of our trial. And so our results came out in JAMA back in December of 2022. And what we found in our study, we worked with around 150 individuals. They were around 77 years old, those 13 sites in terms of around Baltimore of senior centers and affordable housing. And those individuals, half got the intervention right away in terms of met with a community health worker, got a over-the-counter device, and then half had to wait until they got the intervention. But at the end, everybody got the intervention or the program and the device. And so what we found is an improvement in communication function. So how did people feel like their hearing loss was impacting them? We found about a 13-point improvement in communication function. That 13 points, that doesn't, I know, mean too much, but those 13 points, what that is right on par with is if we look in the literature for gold standard hearing aids fit by an audiologist, those 13 points is what we see that's similar to that. And again, this was an over-the-counter device fit by an older adult peer mentor community health worker. And we're seeing similar outcomes in terms of communication function improving to gold standard hearing aids fit by an audiologist. So what this helps us kind of think about in terms of what does this mean is that low-cost hearing technology is an option. For the right person, it is a good option. And that community-delivered approaches, where not everybody necessarily needs to see an audiologist or an ENT. Again, this is my big picture hat of how do we get hearing care to as many people as possible. There are safe and new ways that we can think about getting hearing care. So before I switch to this, I think it's important to point out that what I was just talking about there is really trying to say we have and need a lot of different models of hearing care. A medical approach in terms of seeing clinicians like myself and audiologists will always remain, and they will always be at the heart in terms of guiding kind of hearing care. But it's thinking about really broadly, how can we do things differently? So for individuals, you know, if you're thinking about for yourself in terms of your own hearing care, this is a really rapidly changing landscape in terms of OTC or over-the-counter hearing aids. So I want to spend a little bit of time thinking through over-the-counter hearing aids. Now I'm more of my kind of physician hat on. How are they an option for me? What should I be thinking about when I think about this new landscape that's out there? So I will, just as a reminder for everybody, over-the-counter hearing aids should not be used in these kinds of situations. When you've had kind of drainage from your ear, and we're talking about concerning drainage like pus, thick, odorous kind of stuff. If you're having any kind of ongoing ear pain or discomfort, if you're having dizziness, particularly if you've had a sudden change in hearing loss or a big difference or an asymmetry in hearing between the 2 ears, are really important that you need to see, obviously, a physician or a provider clinician, whether an ENT or otherwise. So over-the-counter hearing aids were specifically designed for people who are 18 years and older. So these models and the model of care that I was talking about with community health workers is not designed for children, for pediatrics. It is designed for individuals who are 18 years or older, and it's designed for individuals who have hearing loss that's about the same, that's gradual. It's really a nerve-related hearing loss, like age-related hearing loss, which we know, again, is the vast majority of hearing loss that happens at a population level. And it's designed specifically for individuals with mild to moderate hearing loss. And so over-the-counter hearing aids in the FDA kind of regulations, this mild to moderate hearing loss designation is perceived mild to moderate hearing loss. It is not that you need to actually have a hearing test done to confirm that it's a mild to moderate hearing loss. It's meant to be very broad. Some of the ways that you may kind of think about whether it's a mild to moderate loss is that you may have some trouble understanding conversations with background noise, but generally do pretty well when it's one-on-one or pretty quiet. You may have a little bit of difficulty on the phone. You may have turned up the volume of the TV or the radio, things like that. And like I mentioned earlier, really feeling like other people are mumbling, or that sensation of I can hear you, but I can't always understand you. Those are all things that really fit within the range of mild to moderate hearing loss. So there's a couple different designations of types of device out there. We talked about over-the-counter hearing aids is a new category within the FDA, and that came out in October of 2022. So really just coming up on a year of having those devices out there. And the thing that's important about these over-the-counter hearing aids is that they're now regulated by the FDA, meaning that they have to meet certain safety standards and quality standards. There's this other category of devices. A lot of these devices I've used in my work as well, and that some of them are very good, but they aren't necessarily regulated. And those are personal sound amplification products called PSAPs. They've been around on the market for 30 plus years. And again, some of them are very, very good and really can't differentiate from a hearing aid. Some are really not that good. So they haven't previously been regulated. When we look at over-the-counter hearing aids, something that is important to think about them is that they're registered with the FDA. And these are some of the different websites and places that you can kind of try to figure out kind of what may fit in terms of over-the-counter hearing aids. But personal sound amplifying products don't necessarily need to be registered with the FDA, but they may be labeled as over-the-counter. So it's pretty confusing in terms of kind of navigating this space here. So within over-the-counter hearing aids is a specific category of self-fit hearing aids. And when you think about regulating by the FDA, well, oftentimes we're thinking about that they actually go through some trials, they're tested, things like that. But if they're just general over-the-counter hearing aids, all they actually need to be is registered with the FDA. There's actually no really kind of in-depth specific review process that happens. What they do is the FDA says, these are the regulations, these are the specification of these devices. And the company says, yeah, they match these. I'm going to go ahead and register. These products don't even necessarily need to exist, but they can be registered with the FDA. A special class within this bigger category of over-the-counter hearing aids is self-fit over-the-counter hearing aids. This particular category is really the category that we're most excited about because this is not just registered, but they're reviewed by the FDA. They have to go through the full review process of a device to really make sure that they fit those safety and quality standards that the FDA puts forward. So this is a relatively small category over the bigger category of over-the-counter hearing aids. So if you're thinking about entering this marketplace, what you really need to make sure you're looking for is the self-fit over-the-counter hearing aids. And that's a website there in terms of the technical code of kind of looking within the FDA of what's out there and available. But really, that's that self-fit over-the-counter hearing aid. There's a lot of different places that you can purchase these devices now. You can purchase them online, purchase them at a lot of different pharmacies in terms of Walgreens, CVS, things like that. A lot of the larger stores in terms of like Costco, as well as audiologists and ENTs are often also offering an over-the-counter device kind of within their lineup of prescription hearing aids right alongside an over-the-counter device. So there's a lot of different places that you may find some of these. Some of the things that you should be thinking in mind for yourself, if you're thinking, is this right for me in terms of an over-the-counter device, is how much do you want to know about your hearing loss? For some people, it's maybe not that important to get a hearing test, to kind of get that objective evaluation, but some people really want to kind of know objectively kind of where their hearing is at. Hearing tests, not hearing aids necessarily, but hearing tests are really something that are often covered by insurance. Hearing aids are not necessarily. Medicare does not provide coverage for hearing aids. Medicaid, so for individuals with lower incomes, that varies by state. And then some insurance provides different stipends and different things like that, depending on what's covered. But hearing testing, just to see where your hearing is out, is often covered by insurance. Other questions to think about is how much do I really want to navigate this on my own? And if I run into an issue, do I have friends or family that are able to help me, particularly on the tech side of things? And again, how comfortable am I with technology like smartphones? Because a lot of this, especially those self-fit hearing aids, in order to get them at appropriate level to match your hearing loss, do rely on you being able to kind of use and connect your device with a smartphone. So if you're going to try an over-the-counter hearing aid, some things that you should be thinking about. Does this device need a smartphone or computer to set up? Oftentimes they do. And so whether that's you have a smartphone and computer, or your loved one you want to get them set up and running with, whether you need to give them a smartphone to kind of set it up, or whether they have it themselves. And do they need it just to set it up? Or do you need to have and be able to use a smartphone on an ongoing basis? There's different ways in which over-the-counter hearing aids interact with smartphones that vary by company. How about, do you need to use a smartphone to adjust settings, or can you do it just on the device? Is the self-fit versus preset? Ideally, we should all be kind of using self-fit, because then we can really make sure the device is tailored to your specific hearing loss. Versus preset is kind of just a general guess of kind of common kind of forms of hearing loss. If you do the self-fit route, oftentimes you will need to be able to download an app and then connect that device via Bluetooth to your smartphone, computer, things like that, but generally your smartphone. Is there a trial period? And what is the return policy for this manufacturer? Also to keep in mind, is it rechargeable or does it require batteries? Then something that is used oftentimes in theaters, larger venues, is something called a loop system. So a lot of different hearing aids can include something that's called a telecoil, which allows your hearing aid to connect directly to a loop system so that you can hear very clearly with concerts or theater productions, things like that. And so does this over-the-counter device, does it feature that in terms of a telecoil? And then how about, can I use this device kind of like a Bluetooth headset to talk on the phone or listen to music, things like that, if that's important to you. Things to be thinking about with over-the-counter devices is, what oftentimes hearing aids rely on, being able to kind of pick up what you want to hear and kind of put in the background what you don't want to hear, is a series of directional microphones. Something to think about in terms of settings where it's really challenging to hear, like restaurants, is something like a remote microphone, which is a device that connects to your hearing aid that moves the microphone closer to who you're talking to or sitting with at dinner, so you can more hear what's being said and not so much all the background noise at the restaurant. Telecoil, we've talked about in terms of the loop system. And then things like, what are the size and the layout of batteries? Also, oftentimes a lot of these devices, because they're trying to save space on this really tiny device, is that they'll use kind of ideally verbal prompts, so that if you're pushing a button or making adjustments, it's not just going beep, boop, whatever, but that it's saying volume up, volume down. So you know exactly kind of what's going on in terms of your hearing aid and kind of manipulating it. What are the different charging options? And how easy are some of these training materials to kind of navigate and get through? I will just, by no means is this exhaustive, but I'm just going to put there a number of different devices that we've used within our studies. These fall in that category of personal sound amplifying products. And so they are not technically regulated by the FDA, but all of these are ones that we've tested within our center and we've used within our studies because they meet really high quality standards that are really very much the same as hearing aids on a lot of different fronts. The Sound World Solution CS50 Plus, they do look, for some people, like this because it looks like a Bluetooth headset, doesn't even look like a hearing aid. And then Sound World Solution Sidekick or Companion is another device that looks a little bit more like a traditional hearing aid, and that's, you can see the prices there for one device. In terms of those self-fit over-the-counter hearing aids, there's really only two that fall in that self-fit over-the-counter hearing aid category. And that's the Jabra Enhance and the Bose Lexi. And you can see that they're running around $800 to $1,000 for two devices. So that's kind of where our starting price point is right now for over-the-counter hearing aids. And I think we're all very anxiously awaiting to see where this kind of space evolves in the coming years, because we're hoping that the price drops further as more people enter the market in terms of different device manufacturers, and hopefully more people navigate their way to thinking about over-the-counter hearing aids. But there's a lot that's opening and changing in this space. But these are two products that are very high quality and have been reviewed by the FDA in terms of safety and quality. For individuals who you're thinking about having supplemental devices or have other concerns or issues, things like pretty significant hearing loss, but other issues, they don't necessarily have hearing aids or don't want to go down that route, or they have changes in memory, or they have really difficult time kind of adjusting small buttons in terms of had a stroke or bad arthritis. Two really important devices to keep in mind that can be very helpful is the Pocket Talker Ultra Duo or the Super Ear SE9000. So you can see these devices around $100, $150. And they can be very helpful for individuals, whether kind of all the time or really just in terms of, going to a doctor, watching TV, having, dinner conversation. But for the right patient and the right person, these can be really helpful devices that can make a big difference and are very affordable and are, I think, really important to keep in mind if you're thinking about kind of different situations. So you may have hearing aids that you use sometimes, but then, in other situations, you may have this device, or this may be one of the devices that you kind of go to. So a couple different resources. I mentioned I serve on the National Board for Hearing Loss Association of America. They have a lot of different resources, and they're always adding to it for people who are looking to kind of just in hearing loss in general, but then also over-the-counter hearing aids specifically. And then hearingtracker.com is another website to kind of look at and see what are some of the over-the-counter devices that are out there. As I mentioned, we are at a really, really important time in terms of hearing care. We have had from 2016, a lot of different recommendations of how we can move forward in increasing access and affordability around hearing care. We've had kind of federal legislation that is really changing the landscape. The WHO, we all work very hard to put out our first ever world report on hearing, to really think about, what can we do in the space of hearing care. And then we're really having kind of high quality, rigorous studies that are showing, like the Achieve trial, showing that hearing matters and that we really need to make sure that we're prioritizing this. And as we're also thinking about, right, for ourselves, but we're thinking about everybody at the population level or that public health perspective of how can we make sure that we bring as everybody along with us in terms of access to hearing care. Because at the end of the day, this, at least for me, and I think for many of us, is what it's about in terms of making sure that every older adult has access to the tools they need to age well. So we'll end there. And yeah, I'm excited to talk with Kelly and answer some questions.
Dr. Nieman, thank you so much. A lot of great information. We've got a lot of questions. So why don't we just jump right in? How about that? Okay, so Joe, it's a great question. He wants to know, so how can you get someone to get over the stigma of wearing a hearing aid? And, because they're embarrassed or, they think or maybe they think they don't need it.
Yeah. This is a really tricky one that we, I think as a society, I think hearing aids, right, I think has a lot of different levels of things in terms of stigma, in terms of just general ageism that we have in our society, in terms of things around disability and ableism. Like there's many layers to why we have the stigma in society. And I will say, some of the things that I've learned from my work is, the HEARS program that we've been doing, was never designed to specifically target stigma. But I will say something very magical happened, that, at least from my perspective, when you have kind of individuals talking and sharing from their own experience, kind of what their hearing care journey was in terms of, yeah, I didn't want to wear a hearing device, or yeah, I didn't really, feel comfortable in what it looked like. But I think having kind of those shared lived experiences can really speak volumes and kind of be like, yeah, maybe this is something that I'm open to trying and seeing if it helps me. So I think there's something to be said for, yes, I can only go so far, when somebody comes to see me in clinic, and I say, yeah, it's important, you should do this. But it's a very different thing to be able to go home every day and be like, yep, I'm going to wear my hearing aid. I know it helps me. I feel good about this. I feel confident about this. This is what I need from me, for my brain. And I think that's a very different message that we can get when we talk about and share things with peer mentors or community health workers. I think there's different things that we can get from different types of providers who play those roles. So I think that's, one part of it. I think big picture, especially as we're learning more and more about the impacts and the concerns around hearing, I am hopeful that that changes some of the things that people think about, hearing aids of like, yeah, I got my hearing aids on. That's true. Yeah, these are my like anti-dementia hearing aids. And that's not obviously true for everybody. But I think, those are the ways in which like, yeah, I'm actively taking a role in my life to help make me as healthy and as engaged as possible. So in terms of some of the narratives that we think about that, I hope will change. I think a lot of the form factors in terms of over-the-counter devices, right? AirPod Pros are technically a form of hearing aid in terms of they provide amplification. So I think there's a lot of things that are on the horizon that will be changing very quickly in terms of kind of how and where people get a little boost in amplification and come in a little different and a lot of different form factors, not just hearing aids, but even things like glasses, for example, that have some different types of sensors and speakers and things that may be able to help give you a boost. So I'm right now, I know we may feel like it's limited in terms of options, but I'm really hopeful for the future in terms of what it may mean for the ways in which we kind of think and change stigma around that. But I hear you, it's definitely a barrier for a lot of people.
Right. I mean, I also think too, maybe your relatives and close friends, which you also touched on, but they're missing out on conversation, which goes back to what you talked about earlier about loneliness, frustration, and depression.
Yeah.
So perhaps that I know family members and friends, but can keep telling somebody that, hey, you're really missing out on what's going on here. And I can see though, with this next follow-up question from Anne, she feels that for someone that's older, that those OTCs that you have to do with apps are quite daunting. So are you saying that most of them are that way, or are there some that are not that way?
Yes.
That's her question.
It's a great question. And so that is exactly why we have done some of the work we've done in terms of HEARS and trying to think more broadly, because we recognize that I think for many of us that, navigating that space and that online marketplace generally is daunting for a lot of people, whether older adult or otherwise. And that it's exciting that for those who are able to navigate that space, but there are a lot of people who won't be able to navigate that. And so how can we think very broadly about how we can get older adults and really all sorts of individuals connected with these different types of technology? And so that's when I think and talk about different models of care, for me as a researcher and clinician, is how can we develop kind of safe, high quality, different models of care to try to connect more older adults to these different types of technology. And I think, right now, I 100% hear you and agree in terms of there's just a lot of barriers out there in terms of the apps and the technology that's needed. But I think what I'm hoping in terms of one of the points about the promise of over the counter in terms of growing the marketplace and pressure is that we will hopefully get towards devices that are more responsive to the needs of actual users, so that people are actually thinking about, well, how hard or easy is this from an older adult perspective, right? Like the primary user of a lot of these devices. Traditionally, there's been 5 hearing aid manufacturers, and that's it. And their kind of model has always been to necessarily kind of sell to the audiologist, who then turns around and sells to the patient, right? And so now we're hopefully kind of switching that in terms of the direct person who's buying it, the consumer, is now somebody who's hopefully asking and demanding different things, from the device. So that, I think that's a long-term goal, but I know we're not there yet. In the meantime, I think thinking about the service side of things in terms of how do we help people navigate this is going to be important and needs to come alongside. So for example, Medicare coverage is something we're always advocating for, to expand Medicare coverage of hearing aids, but it needs to come alongside and make sure that not just the device or some portion of the device may be covered, but that services, that you can get the help you need from professionals or various individuals, that's also part of this.
Mhm. Well, it sounds like they're moving in the right direction on that, and hopefully that they'll begin to make those things easier and easier. So, I mean, nowadays, as we know, everything is attached to an app, right? And so hopefully with the hearing aids, that will become easier for everyone. And on that same note, we have a question from just her initials or his initials, CV. Do hearing aids, sorry for this, I'm trying to read this. Hearing aids prescription or over the counter, do they zero in on human speech? Like the 5
Mhm.
sounds that could make someone with like the hearing sensitivity, I think what they're trying to say. Would it make them uncomfortable too? If you have a
Yeah,
sensitivity in hearing.
yeah. So there's kind of two things to think about there. Whether we're talking about prescription or over-the-counter hearing aids, high quality devices have a lot of different processing algorithms that they are using, that the device is using to try to process, and say, pick up what you want, they think you want to be hearing, and not so much all of the other background noise. And ideally, like the self-fit or the prescription, that they're actually fit to your needs in terms of where you need a little bit more boost in terms of pitch and things like that. Low pitch versus higher pitch sounds, that's giving you the boost that you need. So there is, yes, a lot of that technology that's trying to zero in on, what you want to hear. The other kind of thing to add to that in terms of the sensitivity is there's a phenomenon that comes along with hearing loss, that although you may have some hearing loss, at the same time where you may need a boost for things, may be a little bit more sensitive to sounds. And this is something that many people with hearing loss may experience is I've struggled here and there, but I still feel like some sounds are very irritating or bothersome to me, and not necessarily just with hearing aids giving that extra boost, but in general. And that's a phenomenon called recruitment, where we have these remaining kind of hair cells kind of at a microscopic level where you've lost some, and that we have these sound waves and signals coming into the inner ear, and those kind of hair cells at the inner ear are responding. And because they've kind of lost some of these cells, they're kind of neighbors, they kind of have they respond too much. Too many of these different cells kind of respond when a sound is played because of some of the hearing losses happen. So we kind of have this paradoxical thing where even though, we need that extra boost, sometimes in some situations, you still may feel quite sensitive to kind of loud sounds or different things like that, just because of just the nature of changes in hearing. So those are kind of just two things to keep in mind for that question.
Would you eventually get used to that or get comfortable with that over time?
So that's the type of thing that for many people, if anybody has kind of went through the early part of the hearing aid journey, knows that it can be quite difficult to get used to hearing aids because things sound too loud. You're hearing things you don't want to hear. You're not used to hearing in terms of background noise, plates clinking, utensils clinking, things like that. That it takes at least a month of regularly using hearing aids to kind of get used to some of those things. And at no point in time should it be painful, but it may be uncomfortable and irritating as you go through that process. So if somebody, gets a device and wants to try it out and feels pretty comfortable that it's been fit appropriately for them and or, self-fit appropriately, it's really important that you take the time to regularly use them before giving up on them, because there's actually structural changes that are happening in the brain when they do MRIs of people kind of before using hearing aids and after using hearing aids. Like they actually see changes in the MRI in terms of the brain function function that goes back to fairly normal after somebody's using hearing aids for a while. And so to have that process happen and get used to them, you need to make sure that you take the time to get used to them. It's not like glasses where you just put them on and it's done.
So Dr. Nieman, so following up on that, Amy wants to know, so you're wearing your hearing aids all day. You go to bed. You take them out. But you can't hear anything. So what do you do on that? Like, if there's an emergency and you
Sure.
can't hear
Yeah.
it or something, anything could be, whether you have a pet or a child
Yeah.
or a
Yeah.
loved one there.
Yeah. So great question. For individuals who are more in the mild to moderate range, I'd say generally kind of alert signals and things like that, should still be kind of in the range of things that you're able to hear in terms of like fire alarms and whatnot. But if that's not the case, or you have more significant hearing loss, then we think about kind of alerting devices, whether it's things that vibrate or flash. There are a lot of different kind of devices like that in terms of with your cell phone. For individuals, they have a watch part of it, that it vibrates rather than, rings, or, special types of phones or alarm systems for individuals where, you're really struggling when you don't have your hearing aids in. And those, things like caption phones are, free for individuals with hearing loss. They're provided, generally by the government. So if you have hearing loss and you feel like you need some help on the phone, that you can be able to read, while you're talking to somebody, those are great options for individuals who have a little bit more significant hearing loss and find themselves really struggling on the phone, as that's just an additional kind of technology. So there are a number of technologies out there.
Wonderful. I like that idea with when you're sleeping, if you have
Mhm.
something that's vibrating that's on you, just to alert you or some kind of light. That's great. It's wonderful. Thank you. So our next question will be from Yolanda, and she wants to know how this 30-year study, has that been expanded to other areas of Maryland?
So the 30-year study in terms of the
Line
ERIC cohort or there are many different types of epidemiological studies. So studies that have been ongoing for many years that have a small cohort of individuals that are followed. And so that, is one. If we're talking about the ACHIEVE trial in terms of when they were looking at, dementia prevention and things like that, that trial is ongoing. They're no longer looking for new participants. They're following their current participants out now for a number of years. I think, if you're looking for a study to join, there are, many throughout the country, including here at Hopkins. If you're looking for something that's supported by the National Institutes of Health, clinicaltrials.gov is a place to go that you can find, and you can search kind of what you're looking for in different areas and things to see if there's an active trial there. I think the hope for all of us is that it doesn't always live in the realm of research, but that, research informs practice. And that we can use, and that's a lot of the work that we do at our center, is saying, okay, yes, we do trying to do as high quality research as possible, but then to actually get it translated in the real world to policy changes or influencing insurance changes, things like that. So that's what we hope to see, is that it's more in practice. But there are always opportunities to get involved in research through clinicaltrials.gov would be a great place to start.
Can someone actually get into your clinical?
We always have different criteria. Right now, I have a number of studies that for Korean American older adults in the Baltimore area, for example, and we have some open for people who have some changes in memory, who also have some hearing loss. So there are some there, and there's definitely more to come. But the most up to date in terms of where we're at is clinicaltrials.gov. So. And
how would someone go about that? Would they?
So if you navigate to that website, whether it's Hopkins or otherwise, throughout the country, you would navigate to that website and they should have contact information. They describe a little bit of information about kind of what they're looking for. There's always contact information. So, reach out to the individual that's listed as the contact and say, hey, I saw that you have a study, you think I'm eligible or not. Oftentimes in the research world, we have pretty strict criteria what we're looking for, just because that's the nature of kind of how we try to answer questions. But that's where I would generally would start.
Great. Thank you so much. Our next question is from Debbie. And she would like to know, do hearing aids help with tinnitus, or I guess that's ringing in the ear, right? Did I say that right?
Yeah, yeah.
Or is there another device for this hearing issue?
Great. It's a good question. So tinnitus, it's either pronunciation, and yeah, ringing in the ear. So that is something that is very common and oftentimes can come hand in hand with changes in hearing in terms of hearing loss. Generally, what we think about ringing or understand about ringing is that while it sounds like it's coming from the ear, it's actually coming from the brain itself. And that it is something that when we've had some changes in hearing and some hearing loss, and the ear is no longer sending the same signals to the brain then actually kind of fills in that gap and is making the sound. So that's what makes it quite challenging to address, because it's something that is coming from the brain and not from the ear itself. But for many people who do have hearing loss and also have ringing, giving sound back to the ear, so using amplification like hearing aids, can help kind of, for some, not all, but can help kind of give back that sound to the brain and not necessarily get rid of the ringing, but can kind of put it more in the background. If that's not the case or not enough, there's also different things that audiologists can do in terms of putting masking into the hearing aids so that you hear and get the boost you need, but then also can put in different things like white noise or whatnot, to try to help you not focus so much on the sound or the ringing. So those are some things related to hearing aids. For those individuals who have more severe hearing loss, cochlear implants, as I mentioned, which is a surgery. And again, for those people who no longer benefit from hearing aids, for those individuals, when they have their implant on, oftentimes it can very much address their tinnitus. So, but those are all very specific to people who have some hearing loss and are using or need hearing aids in terms of what I just talked about for tinnitus. But yeah, great question.
Thank you. This question is from Maria. She says, I've had hearing aids for several years. Currently, I have a CROS system with asymmetric hearing loss. I have not found much improvement in hearing, even with the adjustments of the app. Is this common?
I would say it can be common really for all hearing aids in general that we can struggle, and for a cross hearing aid. So that's for individuals where for various reasons that the signal is just too garbled in terms of the damage and changes in hearing that have happened, that you're then needing to kind of route sound from the bad ear to the good ear. And so if you're, for some individuals in that situation, if the cross hearing aid is just not working, and you've tried a lot of different ways and work with the audiologist, then sometimes for some people, you may be a candidate for a cochlear implant in that ear if a hearing aid is no longer option. But there's a lot of different things that go into kind of that decision. But you're not alone in terms of having some difficulty with hearing aids and adjustment. And sometimes working with a really good audiologist can help that in terms of changing technology and things. But sometimes it is a little bit of the nature of the changes in hearing that have happened. So I definitely hear you in terms of your frustration. And I know we don't always have great answers to that.
Right. Thank you very much. From Jen, she'd like to know, so before you're even going to get an OTC, should you see a doctor first? You know, if you're just thinking, gee, I think I'm losing my hearing, you pop into the pharmacy and you put them in.
Yeah. So I think that's a very individual question. And I would say if you have any questions, it never hurts to see a doctor and to get a test. But I would also say that if you're like, yeah, it's been slow, it's about the same, not really that, concerned or motivated by kind of seeing an objective result of what my hearing is, then I would say, yeah, go ahead and try out an over-the-counter device and see. So, if you certainly have concerning things of a sudden change, big difference in hearing between the two ears, drainage, dizziness, any of those things, for sure, you should see a doctor. But if you're like, yeah, it's safe. Over-the-counter hearing aids for the right person is safe. And I definitely, if we're kind of move towards those big picture goals of providing hearing care to more people, I would say at a population level, not everybody needs to see an ear doctor. Not everybody necessarily needs to get a hearing test. But if you have questions and you would find it useful, then you should definitely see, an ear doctor or an audiologist.
Right. Yes, you can just trial and error if you want to.
Yeah.
Well, listen, we're almost at the 8 o'clock hour. So I would like to thank Dr. Nieman very much for speaking with us this evening. And she's graciously agreed to respond to any of the unanswered questions that were asked this evening. We got to most of them, though. And in a couple of weeks, you'll receive an email outlining the outstanding questions and answers. In the coming weeks, a video of tonight's live stream will be available on the A Women's Journey website, hopkinsmedicine.org/A Women's Journey, under Videos on Demand. And if you've enjoyed tonight's discussion, please check out our website, hopkinsmedicine.org/A Woman's Journey, for more information about upcoming webinars, our Health Insights That Matter podcast series, and sign up for our monthly emails. Also, we welcome you to register and attend our next in-person A Women's Journey event, Saturday, November 18th at the Marriott Waterfront Hotel. Registration is $55. And those who register will hear a keynote presentation and select 3 out of our 6 seminars to attend. To learn more and register, please visit our hopkinsmedicine.org/A Women's Journey website. So thank you so much and stay well.